I think we should do these two, and can we save this for tomorrow?
Yes, yes,
All right,
yes.
so we're going to do the next two, and we're going to save the Jackie Lacey stuff for tomorrow. We'll bring it all back. Johnny's already done some great work on it. But tonight we're going to a debate, and there might be some more people and some more information that we can go out there and get
Absolutely.
and bring to the table. Like I said, I've been on the phone all day. Healthcare. We need to have a what, fam?
We need to have Medicare for all, because GoFundMe is officially now how people are paying for healthcare in America. And this is a really eye-opening article from GQ, which is good. And basically, GoFundMe has kind of started putting how you, as a cancer survivor, a cancer patient, can find tips to help you raise more money.
It's ridiculous.
Because now GoFundMe, of course, is the thing. And they start by saying, at a time when 60% of all bankruptcies each year are caused in part by medical bills, more and more people are looking for alternative ways to pay for their health care. Enter crowdfunding sites like GoFundMe. Between 2010 and 2017, the company raised $5 billion through its campaigns, and roughly 1/3 of all the site's fundraisers are for medical bills. An estimated 250,000 campaigns for medical bills go up annually, and a search for the word cancer turns up a grand total of 3,266,000 results.
That's ridiculous.
That's
where we're at. Right
yeah,
now.
and then they just talk about how, they give you tips and how, really it's disgusting. It's disgusting that we have to rely on a GoFundMe when there is an economic outburst that happens, especially related to medical bills. We should have our healthcare system take care of all of our people. It's ridiculous. People outside of the United States don't get it. But what else are you going to do? You know what I mean? Some people have died. I have, stories of my friends whose parents have died because they had to stop treatment for their medication because they'd rather not leave their children with medical debt. And that's the thing, like, are you going to choose between living or between leaving your family with so many medical bills in case it happens anyway? And we
see the story of these kids cutting on their insulin. You know what I'm saying? Young kids dying to cut down their insulin because they can't afford it. And, it's so funny because I have a friend. Her name is Poi. And if Poi, you're watching today, I told you I would talk about your GoFundMe on our show. We will bring it up one day. She's on my Instagram. But it's just a shame that she has to go out there and ask for money to live for her process, for her medical bills, because she can't afford it. And the insurance won't cover it. So even if we do have insurance, and it's so ridiculous, fam, that we fund all this money on war, on people we have no idea about what's going on, bombing them around the globe, but yet we can't put our money in collectively to pay for healthcare, and the alarmists, we can't do that. No, wrong. If we're doing it for war, we can do it for healthcare.
And the whole story of Breaking Bad was because the reason he went into meth selling is because he couldn't afford the medical. So here's
one thing I learned from watching Breaking Bad.
American healthcare can turn a nice teacher into a drug lord killing machine.
Yep.
And that story would never exist in a society where there was Medicare for all, because he wouldn't have that problem.